pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So we do have a quorum. We are shy 2 members because they are at the homelessness task force meeting with Administrator Leonard. So that's going to happen next month as well. So I'm hoping we're going to have to change our date is what I'm thinking. So we'll set out a doodle survey probably. Do you guys have any preference as far as, I was thinking like a Tuesday maybe?
He's in there.
Time
I
out?
mean, I think they let him in.
Mike, do I need to restate everything I said, or we're good? All right, perfect. Any public comment? Anyone sign up for public comment? All right, we're good there. For approval of the November 6, 2024 Health and Human Services Committee meeting minutes. Motion made. You have a second? Second. Motion made second. All in favor? Signify by saying aye. Aye. Any opposed? Motion carried. 5, policy issues, discussion, potential committee determination. We have none. Operational functions required by statute, ordinance, resolution, or policy. Discussion, possible action by Health and Human Services Committee. I don't think we have anything. Do you have anything that you were going to bring forward? All right. Discussion on possible action by Health and Human Service Committee to forward to County Board for consideration. We do not have anything. 7, educational presentations and committee discussion. Social Services Department update, including discussion of the delivery model change regarding intensive supervision services and child care certifications. That'll turn it over.
Thank you very much. I am going to start with child care certifications, if that's okay. Kelly Borchert is online from Child Caring Inc. in the event that there's any questions for her as well. So that's why I'm asking just to move that ahead of ISS. But you're correct. We're here today to talk about a delivery model change for our child care certification responsibilities. So Marathon County, you should have a white paper attached as well in the packet about this. So I'll just go over some of those key points for you. But social services is funded by the state, DCF, the Department of Children and Families, to provide child care certification services. Historically, we have done that in-house at the Department of Social Services, and we have had a number of staff provide that really throughout our department, with nobody specifically specializing in child care certification. So we receive a allotted amount from the state. There's no tax levy that goes into that, and it's a reimbursement model. And so in our budget for 2025, we had budgeted what we have historically spent at social services for that, which is around $1,800. We've only been able to put forward about 5 to 10 hours a month towards child care certification. And since 2011, we've seen a 90% decrease in our child care certified providers. We know that as part of the strategic plan for Marathon County, providing quality child care is a huge importance. There was a resolution passed I suppose at the end of 2024 around increasing our providers. And so when we took a look at this at social services, realizing the decrease in providers, the limited amount of time that we have to put forth to that, and all of the strategic goals that the county has set for that, we feel like it is best for us to do this delivery model change where we subcontract with Child Caring Inc., who's located in Mosinee, to provide that service. They are really the experts in child care certification and licensing violations. Within the white paper, you'll see that they already provide that service for a number of other counties located around us. As well as other counties are indicated on the last page that partner with other child caring agencies who specialize in this program. So we wanted to bring that to this board's attention to let you know that that is our intention for 2025, to have Child Caring certify our providers. We will put forward a contract and a monitoring plan that has to be approved by the Department of Children and Families before that contract can be signed, to ensure that essentially it's social services responsibility then to make sure Child Caring Inc. meets all of the requirements. We will do annual visits. We would have the ability to do random visits. They will provide quarterly invoices to social services identifying all of the child care certification activities that they completed, and will determine a rate for those. So it's fully just reimbursing Child Caring Inc. for doing those services, and any unspent funds would be returned to the state. It's really reimbursed only, so they would just stay with the state. We don't get them until they're expended. Are there any questions about child care certification or the rationale for having that service move out of social services? Typically, I'm here talking to you about no longer subcontracting and bringing them in-house, but this is one that we are really looking to the experts so that we can increase our certified providers.
Go ahead.
Thank you, Chair. So you said that the state pays for this,
Correct.
so nothing comes out of Marathon County.
Correct. There's no tax
Okay.
levy that's put towards child care certification.
Is there a cap on that?
a cap?
A
Is that what you-
cap on the amount that they would
Yes.
give?
The amount that Marathon County receives is, I will tell you, somewhere around $61,000. It is $61,694 is the amount of the state contract for child care certification. And so there is a budget amendment that will be needed to be brought forward to the Finance Committee, because we had only put $1,800 as revenue and expenditures into the 25 budget, assuming that social services was going to facilitate this program. We'll put the full contracted amount from the state in as a revenue and expenditure, so we'll zero out. There's no vote needed, as I understand, because it is less than 10% of our overall budget.
Okay, thank you.
You're welcome.
Anything further? All right.
Okay, thank you very much. The next program that we will talk about is our intensive support services. That is under our youth justice purview. And again, this is a delivery model change. So historically, this has been a contract that has been subcontracted out. Initially, it was with Professional Services Group, or PSG, until they left Marathon County around 2018 or 19. And then we subcontracted with Sorona Recovery. They received the RFP for that in 2021. So this has always historically been a subcontracted program. We are looking to bring this program in-house, so opposite of the last one. And again, there's a white paper that goes along with this. This is the primary reason for bringing this in-house is really two. One is fiscal oversight, and one is programmatic oversight. So moving into 2025, when we were talking about budgets with our subcontracted provider, the increase was significant. You can see in the white paper that our contract in 24 was at $310,000, and they had projected to increase that to $400,000 and almost $4,000 for 2025. However, we only allocated $267,000 to this in the budget. So we saved a significant amount of tax levy, this is tax levy, in 2025 by bringing this service model change, or this delivery model change forward to doing that in-house. So those costs cover 2 LTEs that we have hired to run our intensive supervision support programs, and then any additional costs such as electronic monitoring, training, group costs, those sort of things are rolled into that. And so our ISS services really provide additional services to our youth who have been adjudicated delinquent and who are moderate to high risk, doing things like weekly check-ins with them, making sure that they're attending their services, providing them UAs, monitoring their electronic monitors, and they have close collaboration with the social workers that are assigned to their cases. So by moving it in-house, not only do we save a significant amount of money, but we can also provide additional oversight and have additional collaboration. With our Youth Opportunity Center that we have piloted currently, we plan to have one of these individuals housed at the Youth Opportunity Center. As you know, the children or the youth who are attending that are also our moderate to high risk youth, and so there will be a lot of nice crossover. The other ISS staff member we plan to have at the Community Partners campus, which is where they were housed when it was subcontracted. It's a great location that's central to meet a lot of our youth needs, where they can come and meet with them in a friendly environment that they feel safe and comfortable and supported. And so for 2025, we are planning to bring this in-house. We've already hired those 2 individuals. We'll have additional collaboration with them, as I already mentioned, and save a substantial amount of money. The only thing that I really see moving forward with this that we will come back to talk about and ask is to provide an outcomes report of how our services went running them in-house for 2025, as well as likely asking that the LTE positions become FTE positions in the budget for 2026.
Questions?
I think it's great that we're bringing it in-house. You know, the savings is very considerable.
Yes. And the oversight, in my opinion, will be considerably better and increased, and that collaboration, because there'll be our staff in our offices.
All right. If that's it, that's it. All right. Well, thank
Thank
you.
you.
All right. Next meeting date and time. So future, and also announcement, future agenda items. So I did say with, I did talk with Administrator Leonard earlier last week. I'd like to talk to the department heads about as far as like what we have discussed, what we haven't discussed, and then look at how we're filling into the strategic plan as far as what we should be looking at or having discussions upon, because our agenda items obviously are dwindling out here. So we have to look at that a little bit closer. While I have I brought up a calendar, and I guess, so we're supposed to have our Health and Human Services on the 5th of February at 3 o'clock. And it is the same time as the Homelessness Task Force. I guess my question would be, Chris, Public Safety Committee is at 1:30 on the 11th. Could we do it directly after the Public Safety? Just plan on 3 o'clock if it's a little longer. It's a little longer. Do we have to do anything as far as security or anything like that for the doors? Because they're open till what, 4:30? So just with the members here, without talking to Supervisor Cavelli and Conway, would you guys be open to the 11th at 3 o'clock instead of that's a Tuesday? Are we all right? Let's tentatively plan on that. If we could maybe talk to Conway and Cavelli, just to let them know, or I can throw out an email too, just to see if that works for them. Okay. Same time, 3 o'clock. Well, it'll be 3 o'clock, but it'll be after Public Safety Committee. So the Public Safety Committee is at 1:30. So they should be done. If they're not, we may have to wait till 3:15 or whatever it ends up being. Okay. All right, with that, next meeting, like it says there, so February 11th, and we'll say at 2 o'clock. That'll take number 9. Go ahead.
Just a quick question. At that time, could we get an update on the homelessness?
Yeah, and I did actually want it on this one.
I noticed that.
Yeah, and they said they really, they were going to have something in the next meeting. So yeah, we should have something next meeting.
Thank you.
I'll take number 9. Motion to adjourn, second. All in favor? Aye. Any opposed? Motion carried. Quick and painless.
I think the entire town is sick. I was at Walmart and I was like, and then I went to the library with my granddaughter and I was like, I'm like, don't put that in your mouth. Don't touch that.